Welcome viewers. Today I am going to tell you about the various timings that are there and what are the hormonal influence on glucose and on insulin. If you take at midnight 12 o'clock, if you start at 12 o'clock midnight, there will be very high glucose levels because the glucose is very high, because of the glucagon is very high, leptin levels are increased. We have a catecholamines which are raised in the evening coming down by midnight 12 o'clock. ACTH, norepinephrine, cortisol will be in the mid-range, glucagon will be very high, growth hormone will be increased, leptin levels are increased, and the glucose will be at a very highest level at midnight 12. This is even though we are at 2 hours or 3 hours of fasting, if we had a meal at 10 p.m., still the blood sugar will be very high in the middle of the night. This is because our hepatic glucose production is very high at the night time. Why? Because our glucagon hormone is there, which will stop the insulin not to work. So the liver goes on producing more amount of glucose into the system. Second is at midnight 12 o'clock, it is usually NREM phase, that is non-rapid eye movement. It is also called SWS or slow wave cycle sleep will be there. In this pattern, the brain reduces consuming of glucose and glucose percentage increases by 11%. So there will be a lot amount of glucose in the body. It will be circulating in the blood, and the muscles refuse to take the blood sugar. So our glucose disposition rate, estimated glucose disposition rate (EGDR) is highest at midnight. At midnight, even if you take a small tea or a cookie or a biryani or any food if you take or beer and somebody consumes very large amount of alcohol at this time, it will be very, very dangerous and sure sign to get a diabetes because our estimated glucose disposition rate is very high and the muscles will refuse to take the glucose. 80% of the glucose that is there in the body is taken up by the muscle, next by the adipose tissue. Both these will develop a resistance to the insulin, and so our blood sugar will be very high. This is seen in the midnight at 12 a.m. So these people always present as high fasting blood sugar and postprandial blood sugar will be low or even normal. That is where the puzzle is. So 30% of the patients can present as impaired fasting glucose, that is, they can present as pre-diabetes or fasting insulin resistance only because of the nighttime shooting up of blood sugar. And this is more commonly seen nowadays rather than last 100 years is because night shift workers are forming around 18 to 20% of the population. So if you work in the night, the chance of sleep pattern getting disturbed are very high. Melatonin levels are very high. So this interferes with the insulin and our blood sugar will be very high. Not only this, there is a leptin to granule tango combination of leptin stops the whenever it is high not to eat. So we feel already the stomach is full. This stops the ghrelin hormone, which asks us to make a hunger. That hormone will be stopped. So this combination will be working. So whenever you have a sleep pattern disturbance, you are having a circadian rhythm change. That is, melatonin is produced at very high levels, and this produces high glucose. Moreover, daytime sleepiness will increase, and whenever you sleep in the daytime, you are definitely you're going to become a diabetic. So the thing is, at midnight, 12 a.m., the glucagon levels are high. Melatonin, which is a sleeping hormone of nightness, hormone of darkness, is very high. Which these two are opposite to the insulin. So our glucose will be very high. Third is our growth hormone will be very high. This also, along with the cortisol levels, ACTH, norepinephrine, interfere with the insulin action, and so the glucose levels are very high. In addition to that, because of the NREM's phase, SWS, and slow wave sleep cycle, our blood will be sugar will be very high, and muscle or adipose tissue will refuse to take the glucose. So our blood sugar levels will be highest at the midnight, and liver goes on producing glucose because it stops listening to the insulin. Why it stops listening to the insulin? Because our glucagon levels are high, melatonin is high, our growth hormone is high, our cortisol levels are high, catecholamines are high. We are under heavy stress, and blood sugars will be very high at this time. Our leptin, although it is very high, it should stop us from eating at midnight. And there is a dissociation whenever you have a poor sleep pattern between leptin to granule and the circadian rhythm, and the hormonal release of phasic release of melatonin and insulin, which are quite opposite on the spectrum, will become variable. So entire metabolism is based on midnight. So night is a time when the diabetes and love will develop. So it is a night that important for diabetes control, not the daytime. This is at 12 a.m. Next, I will tell you about 4 a.m.